Blood pressure pill. You took this morning 9. Things every senior needs to know: you took a pill this morning. Maybe with your first sip of coffee, maybe with breakfast. Or maybe, like millions of Americans over the age of 60, you took it so automatically that you barely noticed you were doing it. It took about 10 seconds. 10 seconds for something you've probably done every single morning for months, maybe even years. Then you went on with your day. You fed the dog. You checked the weather. You watered the plants. Maybe you called your children or your grandchildren. Maybe you headed to church or settled into your favorite chair. Life simply moved on. But if you're over 60 and the pill you took this morning was Amlodipine, Losartan, or Lisinopril, there is a very real chance that something important is happening inside your body right now. Something many people were never fully told when that prescription bottle was first placed in their hands. And no, it's not because your doctor doesn't care. Doctors care deeply. The reality is that healthcare moves quickly. In a short appointment, your physician has to review your blood pressure, discuss test results, answer questions, adjust medications, and prepare for the next patient. Some conversations deserve an hour. Most people get 10 or 15 minutes. And sometimes the explanation that could completely change someone's understanding of their health simply doesn't fit into that brief visit. That's why we're having this conversation today. After more than 3 decades of caring for adults with high blood pressure, I've seen something happen again and again. People develop swollen ankles. They develop a cough. They feel dizzy. They feel tired. They notice changes in their bodies. And they quietly tell themselves, "I'm just getting older, this must be normal." I guess this happens to everybody. And because they believe that, they never ask questions, they simply live with it. But many symptoms people blame on aging are actually their bodies trying to communicate something important. Today I want to walk you through 9 things every senior taking Amlodipine, Losartan, or Lisinopril deserves to know. One of these points may explain a symptom you've been dealing with for months. Another may answer a question you've never known to ask. And the last one is something I wish every person understood the day they started taking these medications. Before we begin, I'd love to know, how old are you and which medication are you taking? Amlodipine, Losartan, or Lisinopril? Leave your age and medication in the comments. And as you watch, pay attention to the moment that teaches you something new. At the end, come back and tell me, what was your favorite part of this video? Because your comment may help someone else realize they're not alone. And if you believe information like this can help a parent, spouse, friend, or neighbor, please hit the like button, subscribe, and share this video. You never know who might need this information today. Now, let's begin. Number 1. These medications are not the same. Amlodipine, Losartan, and Lisinopril all lower blood pressure, but they work completely differently. Think of your blood vessels like highways. Sometimes those highways become too narrow. Sometimes your body sends signals that tell them to tighten. These medications lower blood pressure by interfering with those processes, but they don't all use the same method. That's important because different medications create different side effects and different warning signs. If you don't understand that, you may misread what your body is trying to tell you. Number 2. Swollen ankles are common with Amlodipine. Have you ever noticed your shoes fit perfectly in the morning but feel tighter by evening? For many people taking Amlodipine, that's exactly what happens. The medication relaxes certain blood vessels in your legs. Blood flows downward easily. Coming back up becomes slightly more difficult. As a result, fluid can collect around the ankles and feet. For many seniors, this can be frightening. They immediately worry about heart failure. But in many cases, this swelling is actually a predictable effect of the medication. That doesn't mean you should ignore it. Report it. Talk to your doctor, but please don't do something many people do. Don't start skipping doses because you're embarrassed by what your ankles look like. Skipping medication can be far more dangerous than the swelling itself. Number 3. A dry cough can be caused by Lisinopril. This one surprises many people. You start a medication, everything seems fine. Then several months later, a cough appears. Not a wet cough. Not a cough from a cold. A dry, irritating tickle in your throat. A cough that seems to come out of nowhere. Many people blame allergies. They blame dry air. They blame acid reflux. And it never crosses their mind that the answer could be sitting inside their pill organizer. Lisinopril can cause a persistent dry cough in some people. The important thing to understand is that it doesn't always happen immediately. It can develop months after you begin taking the medication. If that happens, mention it to your doctor. You don't have to suffer through it in silence. Number 4. One symptom requires immediate medical attention. Most side effects are uncomfortable. This one can be dangerous. If you ever experience swelling of your lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult, seek emergency medical care immediately. This reaction is rare, but when it happens, it needs immediate attention. Never wait. Never assume it will simply go away. Number 5. The hidden potassium problem. The risk isn't always inside your medicine cabinet. Sometimes it's in your kitchen. Both Losartan and Lisinopril can increase potassium levels in your blood, and many products marketed as heart-healthy contain additional potassium, salt substitutes, electrolyte powders, certain nutritional drinks. The problem is that high potassium can affect your heart's electrical system. Sometimes symptoms include weakness, sometimes muscle cramps, sometimes irregular heartbeats, and sometimes there are no symptoms at all. That's why reading labels matters. If you're taking Losartan or Lisinopril, ask your doctor whether potassium-based products are appropriate for you. One simple question can prevent a problem nobody saw coming. Number 6. Pay attention to pain relievers. Open your bathroom cabinet. Do you see ibuprofen or naproxen? Most people don't think much about them. They came from a store shelf, so they don't feel like real medicine. But regular use can become a problem for some people taking blood pressure medications, especially when dehydration enters the picture. That's why it's always wise to ask your pharmacist. But if you become sick tomorrow, things can change. Vomiting, diarrhea, heavy sweating, not being able to keep fluids down. All of these situations can change how your body responds to medication. The medication didn't suddenly become dangerous. The environment inside your body changed. This is especially important because dehydration can sometimes lead to dizziness, weakness, or very low blood pressure. If you're significantly ill and unable to keep fluids down, call your healthcare provider for guidance. Number 8. One blood pressure reading means almost nothing. Blood pressure changes throughout the day. Stress changes it. Caffeine changes it. Lack of sleep changes it. Anxiety changes it. Even worrying about your blood pressure can temporarily raise your blood pressure. A single number is not a verdict. It's a snapshot. The best approach is consistency. Use the same arm. Sit in the same chair. Rest quietly for 5 minutes first. Take readings around the same time each day. React to patterns, not moments. One number is noise. A pattern is information, and only information deserves a decision. Number 9. The most important truth. This may be the most important thing you'll hear today. These medications help control blood pressure, but they do not erase everything that contributed to high blood pressure in the first place. That's why lifestyle still matters. Sleep matters. Activity matters. Nutrition matters. Stress management matters. Follow-up appointments matter. The people who do best over time are usually not the people taking the most medication. They're the people who understand what their medication is doing and what it is not doing. Because understanding creates confidence. Confidence creates better decisions, and better decisions often lead to better outcomes. So before we finish, I want to ask you something. Do you truly understand what your medication is doing inside your body? If the answer isn't completely yes, that's okay. That's exactly why conversations like this matter. Now I'd love to hear from you. How old are you and which medication are you currently taking? Amlodipine, Losartan, or Lisinopril? And tell me, what was your favorite part of today's video? What surprised you the most? Your comment may help another person who has been dealing with symptoms in silence. If this video helped you, please take a second to like, subscribe, and share it with someone you care about. Because somewhere tonight, someone is sitting quietly in their living room worried about symptoms they don't understand. And sometimes one explanation, one answer, one conversation can make all the difference. Thank you for spending these minutes with me, and I'll see you in the next video.